What causes ill mental health? Can a person truly be healed from a mental health illness? Barbados is making significant strides where mental health legislation is concerned. Legislation that's progressive and also inclusive. In this special program, we speak with leading psychiatrist and medical lecturer Dr. Maisha Emmanuel. This is One on One. I'm Michron Robinson. Welcome on set, Dr. Emmanuel. We're here in the ER Walren complex here in the Cecil Cyrus Museum. And you're a lecturer at the University of the West Indies and also one of the leading psychiatrists that we have in Barbados. We're happy to have you on the program, ma'am.
Thank you. Thank you for having me.
You are most welcome. As of October 10th upcoming, we're going to be recognizing and acknowledging Mental Health Awareness Day. What's the theme and why is it important for us to acknowledge mental health awareness?
Right, so this year the theme, and this theme is developed by the World Federation of Mental Health. It's access to service, mental health in catastrophes and emergencies. And it's quite fitting. As you know, the world, we've just been through a pandemic, and locally, Barbados, we've had hurricanes, we've had freak storms, we've had all sorts of disasters and emergencies. And so we're quite happy to have that theme so that we can, increase visibility of mental health. We want to always reduce stigma and raise awareness generally. And so the theme is quite fitting this year.
What does it look like? You've been making some strides and progress in terms of new legislation. So what does that look like and what can Barbadians expect as well?
Right. So we've made many changes. The current Mental Health Act was first written, back in 1985. So it's been quite old. And so in approaching the rewriting of the new act, and we looked at the things that we would like to accomplish that were not specifically written into the old act. So we took a very much a rights-based approach, recognizing that people have the right to, accept or refuse treatment, be treated in the least restrictive environment, and that means including at home or in the community by the polyclinic system, pretty much moving away from the need to be in hospital, whether it's the psychiatric hospital or the Queen Elizabeth Hospital where I work. We wanted people to be able to access care without having to come into hospital. And we saw that as a fundamental right. People have the right to choose whom they would like be part of their care. So for example, right now in the current act, your next of kin has that right,
yes,
but you may not want your next of kin involved, right? So the new act gives you the option upfront to say, I would like this person, not necessarily my parents
right,
or my siblings or whatever. So we're pretty much changing the way, and that's the important thing. It's a shift in the mentality around how do you manage, how do you approach someone having a mental health condition so that it is in line with any type of physical health condition and the way in which you view it.
Mm-hmm. Leading up to the work put in regarding this new act, you've had a series of town hall meetings, most of them very well attended by Barbadians. Why was this engagement, stakeholder engagement, so important as well for the Ministry of Health?
Yeah, so we thought it's extremely important that people, the public, had ownership of what we put into the act, because sometimes you feel that people write laws and this is the law, and then you're left, how does that apply to me, and why? I would like to see something a bit different. So we thought the approach would be to approach the stakeholders first.
Yes.
Even before we wrote anything, we reached out to a number of different organizations. We heard what the issues were. Then we set about doing our own research and collaboration with PAHO and so on. Then we went back to those stakeholders again, and then we had the public consultations that you were referring to. And we were very pleased to see how engaged the public was in terms of giving us feedback. People joined online, People turned up in person. People, went onto the ministry's website and gave information on email. So people really engaged, and we think we've had quite a wide cross section of individuals as well as organizations who would have given feedback. And we have just recently incorporated all of those comments and questions and so on to ensure that we've captured everything that everybody was asking and commenting on. And so we now have our final draft, so to speak, because as you imagine, it's still in the form of legislative notes. We're not writing the bill. That's for the persons who write bills. But we now have something, a document that we can now present to government and say, okay, these are our thoughts, opinions, and also the thoughts and opinions of a wide cross-section of Barbadians.
Mm-hmm. Considering all you have said, I'm curious to know, it's going to be a process in terms of presenting the legislative notes and having the official processes from our policymakers. But where was the initial thinking in terms of having persons access mental health care outside of the psychiatric hospital as outlined in the bill?
Right. So, with everything, we're not reinventing the wheel. Mm-hmm. There are international standards, but then again, you can't just take standards from other countries and say just wholesale apply it to Barbados. So we really had a lot of consultations amongst the persons who use the acts, like the psychiatrists and other mental health professionals. And we really first started off by consulting with each other and having those discussions about how best do we approach what we're setting out to do. And so, yes, it's international standards, but for our purpose and for our use. And we were very, very clear on that. Because sometimes when you read things from other countries, because of their population size and their resources and their specific cultural peculiarities, we should say, they have things done in a certain way. And so we thought it was very important that whatever we came up with had to fit our population and our resources, etc. And so it was quite an involved process. And I must say we're quite proud of what we've been able to produce, because it is from us by Barbadians, and that was important for us.
Mm-hmm. Considering the work that you've putting up until this very point, as of 2020, the world experienced a pandemic, and subsequent to that, a lot of us experienced a mental health crisis to some degree. Mm-hmm. How confident are you in the work of the psychiatric hospital in areas of catastrophes as well, considering the theme for this year?
Well, it's a matter of mental health professionals do not have a choice. We have the responsibility of managing when there are emergencies and catastrophes. And so I think it's fair to say that we have a lot of experience with that. And so for over the years, you would see that we have kept up with the practice of psychiatry. So although, we were just saying that the act is outdated, et cetera, on the ground, the practice of psychiatry, the medicine of it, the talk therapy of it has kept up with what has been happening around the world. So I'm quite confident that we've been able to deliver the services that we need to deliver. One of the things that we've introduced at the psychiatric hospital is the whole psychological first aid. Through the Ministry of Health and Wellness, of course, where people are being trained. And I'm saying people, meaning you don't have to have a degree or any kind of medical background. People are being trained as to how to deliver psychological support when there are emergencies. We were talking about pandemic and all of that just now, but something like a car accident. And people are distressed and, people are injured. How do you, on site, take some measure of control and support people who are in that moment going through a crisis? And so the psychiatric hospital has been training persons in psychological first aid. Again, another measure that we've used to ensure that we are meeting the needs of the population as they arise.
There have been some pressure on the Black Rock Psychiatric Hospital during COVID. What's your sight in terms of this waning with the additional assistance from those who may be taking on some of these courses that the hospital is offering as well?
Right. So during COVID, you would imagine quite an acute increase in the numbers of persons who were accessing mental health care. And so what helped is the fact that now we have psychiatrists and other mental health professionals in each polyclinic. So every week, in every polyclinic, there is a mental health clinic. And so that has served to take the burden off of the psychiatric hospital. Of course, there's the mental health unit at the Queen Elizabeth Hospital, again, serving to meet the needs of the population there. And from what you're saying, what we were talking about just now, about people trained in psychological first aid, so that on the ground, without having to access, nurses and psychologists and psychiatrists, there are more people within the community who are now well placed to offer that acute intervention when a crisis occurs. And so it's about now building capacity and increasing the numbers year on end who will be trained up in this skill, and having those persons deployed throughout the community.
Dr. Emmanuel, in getting to the core of your work as a psychiatrist in Barbados, what's the single most pressing issue that a lot of persons, be it youth or older persons, are facing where mental health is concerned?
But the most common things people present with to me would be depression and anxiety. And I can't emphasize this enough. People often equate seeing a psychiatrist with, that's because you're hearing voices or you are paranoid and those types of things. Yes, that is one part of it, but that's a small part of it. The overwhelming majority of times people come to see a mental health professional is because of issues related to your mood or feeling anxious. And that's important to recognize, because I think that understanding goes a long way in reducing the stigma around accessing care. And you wouldn't believe how many people would say to me, no, I can't come back and see you because people might see me, people might see me coming to the ward, or if I have to go to the psychiatric hospital, people might see me going there, and therefore I don't need to go. I would say it's better now than what it was, 10, 15, 20 years ago in terms of the resistance, but there's still some pockets of that there. So the short answer to your question is depression and anxiety would be the most common reasons people access mental health care.
And what are some of those misconceptions that you would kind of want to dispute on air for our audience as well?
Right. So I think there are so many different misconceptions. As I said, the first one being why people would access mental health care. I think people's perception that it's always going to be medication, I think that's another misconception. There are different modalities of managing a situation, and whether you want to take medication or not for a depression episode or anxiety, that's something you make a decision about. I often say to people, when you make a decision, you have to have all the information and then you make a decision. So it shouldn't be based on, well, so-and-so told me that this is their experience and therefore I'm not doing it, or therefore I'm doing it. That's not an informed decision you're making, right? Yeah. So you need to start off with having accurate information. And I'm saying accurate because, again, so many times people go on the internet, they go on Instagram and different social media platforms, and people say what their experience is, not necessarily giving you the full picture or understanding the interplay between symptoms or other medical conditions or whatever other thing may be happening in their lives. And they give you that as their truth. And right. That's their truth. I'm not saying they're deliberately trying to give you the wrong information, but the information is not accurate. And so people make the decisions for themselves based on inaccurate information. So it's important to understand what is happening to you, research, read around it, talk to your doctor, your other your supportive circle, if it's your family, your partner, your friend, whomever it is. And when you've done all of that, then you are more informed to make a decision that's best for you. Okay?
What role do you think social media has to play in terms of depression, anxiety amongst our youth?
Right. So I think, like everything is, there's good and bad in it. I think on the one hand, done properly, social media is a fantastic tool because it puts people in connection with each other. You will find out a lot of information, again, accurate information. You can have support groups via that on social media. And so from that point of view, excellent resource. I think the downside is when occurs when there's wrong information, or people are using social media to bully each other or to spew untruths about people. And so there's always, and this is something I do all the time, there's always the balance between what is helpful and what is less helpful, and what is risky and what is downright not should not be aired. So there's always that balance that has to happen, good and bad.
Leading back to your mention of depression, what's the main cause of depression according to persons who would present to you normally?
Right. So there's a combination of factors that would, for any mental health condition in general, specifically for depression, we often look at things like predisposition, meaning, is there somebody in your family who's had depression? So that means just from a genetic point of view, it puts you at higher risk, right? Then there is things like what stressors, what things are happening in your life that are contributing to the way you're feeling. And what we find is often it's not just the one thing, right? It's the one thing and then another thing and then another thing. And then you end up with layers of things. And sometimes people will say to me, but that's not a big thing. Why am I so bothered? And then when I go back in the history and I start to talk about experiences, you recognize that this person over a lifetime with various stressors and things happening to them, it's not just the one thing that the triggering thing. There are many other things that would have been happening. Okay, so it's genetics, and then there's environmental factors like what I'm talking about, different stressors and multiple stressors, whether you have support or not. So there are many reasons, many things that come together to then contribute to somebody developing a clinical depression.
Dr. Emmanuel, at this time, we're going to pause for a short commercial break. Don't you go anywhere. We'll be right back with one of our leading psychiatrists here in Barbados, Dr. Maisha Emmanuel. Stay with us.
Keep it clean, keep it green.
Barbadians, we invite you to get involved and play your part as we clean and green Barbados. Come into your community with media launches, bulk waste collection exercises, community engagement sessions, and giveaways. Get on board. Let's keep Barbados clean and green.
Beautiful, beautiful Barbados. Keep it clean, keep it green.
Hi, I'm Naomi. This National Cleanup Campaign is your chance to make a difference. Let's work together to protect our environment and keep our neighborhoods clean. National Cleanup Campaign. A cleaner tomorrow starts today.
Keep it clean, keep it green. Be proud of our nation's beauty.
Welcome back to this very special one-on-one. On set with us this evening for one-on-one, we're having a conversation with Dr. Maisha Emmanuel. Dr. Emmanuel, for our viewers, we've touched slightly on youth development where mental health is concerned. What are some of the practical steps that young persons can take in terms of engaging with their communities, civic participation, where the mental health space is concerned?
Right. So I think a big part of youth involvement is around advocacy, because oftentimes young people respond much better to their peers than somebody, like me talking to them. So they do much better with somebody closer to their age. So for example, in doing the act and rolling out the mental health act to the public, we had involvement from two youth organizations, Let's Unpack It and Healthy Caribbean Youth. And they were very instrumental in, social media and in other areas in helping us roll out the act to a young person. So they held, for example, their live where they invited young persons from amongst their constituents to take part in an interview and discuss the act and what it was going to mean for them. And we found that very useful. And so it's important that young people get involved in advocating for themselves, because more than anything, of course, they know what their challenges are, what challenges they face, and so they're best able to articulate for themselves what they think the solutions would be. So advocacy, I would say, is a important tool for the young people.
Mm-hmm. You've also included some mental health representatives in terms of sharing their lived experiences as well.
Yes.
For you as a psychiatrist, why was this important and how effective is this as well?
Very important, tremendously effective. Again, listening to me as a psychiatrist or a lecturer talking about other people's experiences in a general sense, that's fine if I am teaching, or we're doing public education, but nothing works better and gets the point over than someone with the actual experience. Because, I am talking about people with depression. If somebody with depression is right there to say, that's good for the textbook, but this is what I felt. This is what I experienced. This was the impact. That is a fantastic tool because people can connect with that, right? And so I think the other thing why it's so important is that 20 years ago, not many people would do that. But now you have these brave young people able to stand up and say, listen, this is my experience. Yes. This is what I've had, and you take it and leave it. But that is, I am telling you, so they own it, and they're not ashamed, and they're very capable of saying exactly what it meant to them. And it went over really well with the audience because people can connect with that more so than just talking about mental health in a broad sense. So it was very important for us to have those young people talking about their experiences.
Love that. Absolutely. And speaking of lived experiences, why was it so important for you to dedicate so much of your life to the advancement of Caribbean and international psychiatry as well?
I think on a very personal level, I lived in a household with an uncle with a mental health condition. And as a child, I had no clue what that was. Mm-hmm. I just knew he behaved in a way that was concerning sometimes. And it was only when I became an adult and got into medical school, I recognized that's what that is. Ah. Right? So it was very much an eye-opening moment for me. Then when I actually did the specialty of psychiatry, it just made so much sense that you can watch the change in somebody's presentation as they recovered from whatever it was that they were experiencing and see that person maximize to their full potential. And again, it was like, wow, that was amazing for me. And so it has always been important for me to be in this specialty area long before it was even something people respected, to be frank. People, when I initially said I wanted to be a psychiatrist, I got some support, but it wasn't overwhelming support. I'll put it like that. But right now, today, I'm satisfied that I made the choice that was best for me. And so I love what I do, and I enjoy doing it every day. Mm-hmm.
How do you rate the success of persons living with a mental health condition? What does that look like in saying this was a successful case?
Yeah. So I think how people do or their long-term prognosis depends on a lot of things. But a big part of that is the support that they receive from their family in particular, right? So the people who do really well, who recover, who prosper, who go on to continue their successful lives, whether it's in relationships, career, whatever it is, are the people who have the most support. When people shun you or complain about you or not there to support you, that's when people do a fare worse than when there's a lot of support. And so if nothing else, people take away from of listening to this conversation is how important it is to be there for your relative, friend, partner, whomever it is, because that support is paramount.
Which leads me to another point, the importance of talk therapy. For us as human beings, it's most of us spend money on grief counseling and all types of counseling, which speaks to the importance of your work and lending a listening ear where talk therapy is concerned as well.
So that's one of the things when people come to me with whatever condition, I say, and often they come and say, that medication thing, I don't want medication. And I say to people, medication has its role, but it is not the only thing.
Right.
Taking a pill is not going to address all the issues that we were talking about earlier that will contribute to developing a mental health condition. So talk therapy is a big part of that. Now, talk therapy involves your engaging. So it's not we sitting down and having a chat. And that's not what talk therapy is. There's active work that has to be done. So you and your therapist will set up whatever you and your program, the therapist and you come up with, and you have to actively engage in the work that is needed so that you can recover. Okay? And so take-home points being, it's not just about taking a tablet. For some people, that's not even necessary, right? Talk therapy, very important for you to engage and do the work that you and your therapist decide that whatever it is that needs to be done.
Where does Barbados rate in terms of its progression where mental health is concerned on a regional scale or even a global scale, considering the advancements that we've made as a developing country?
So we've kept up with what is recommended internationally, the different techniques we were just talking about with talk therapy, the different medications that are available if that is required. What we are still lagging behind are the other forms of therapy. Art therapy, dance therapy, occupational therapy. We have a lot more than the other two, but they're those types of therapies that we still have limited knowledge about. So there are therapists on island, but people still need to understand a bit more about how those things are important and how they form part of your overall management plan. So we are advanced and have kept up in some areas, but we lag behind in other areas. Not so much because we don't have the therapist, but more so that people don't understand what the role of those different types of therapy would be.
And while we give thought to these different types of therapies, for people who don't have that family support in Barbados, how can that support be provided, be it friend groups or other groups?
Right. So this is where I often encourage people to, become part of some type of social organization. So you may not have parents and siblings and, extended family, but there's so many different groups around that you can be part of. And often groups have mental health services attached to them. Or it could be church, or it could be, you like doing certain sports or whatever it is. Find connection, not just any connections that mean something for you, that will bring meaning to your day-to-day life. And that is the way in which you form your own community. And don't get me wrong, I know sometimes that can be very hard, but I think there are any number of organizations out there, any number of groups, any number of places where you can join various groups. If it depends on your age, like what you have BARP, or by what you like sport or whichever organization, but there are many organizations out there that you can be a part of, so that you find your community where best it's located.
In terms of people watching the program this evening and your mention of the importance of building social capital, sometimes there are a lot of messages out there about mistrust. What role does mistrust of a family, mistrust of a society play in a person's mental health journey, not, being overly cautious of trusting others?
Yeah. And, sometimes people develop mistrust with good reason. So just because you mistrust somebody doesn't mean it's not for a good reason.
Right.
Right? So again, it's the balance there. It's knowing that, okay, yes, somebody may not be trustworthy, but you are going to try your best to find people who you feel comfortable with. In other words, not painting everybody as not worthy of trusting. I think that's the difference. So you can have a negative experience and come out thinking, man, people, they're not, you can't really take them on because they're not helpful, or you can't believe what they're saying. But the idea is that you don't paint everybody with the same brush, because then you go through life just not opening up, not reaching out for community, not having those, you're not giving yourself the ability to meet people and build that space for yourself. And so recognizing that with everything, you have to be discerning, but you don't paint everybody in the same way, so that you do leave yourself open for relationships. Yeah.
In taking a different turn of our conversation, how is the interest looking in terms of new students for you as a lecturer who are showing an interest in psychiatry like you would have as a student yourself many years ago?
Yeah, that's excellent question, because many years ago when I trained on my own. I mean, I was the only postgraduate resident in Barbados. They were, of course, around the region and so on, they were there, but in Barbados, it was me alone in that final few years. Now, we have a lot more people who have been trained fully. So, now we have persons who have come through what we call the Doctor of Medicine Psychiatry program, and we've had people train and return to the Bahamas. We have a lot of people, of course, in Barbados. And so we have people that go across the region through the program, including the program is in Jamaica and Trinidad as well. Right? So it's been an increasing interest. As I said earlier when we were talking, there wasn't this overwhelming encouragement from some quarters when I wanted to be a psychiatrist, and that was back in the late 90s.
Yeah.
But now I think people recognize the value.
Yes.
Let's put it like that. People recognize the value of mental health professionals, and a lot of doctors now want to do psychiatry, and they have been coming through our program, and our program has been very successful in producing well-trained psychiatrists.
What do you think there's an increased interest from when you studied back then up until now?
I think it's an increase in awareness, because we were talking before about increasing awareness and reducing stigma. Even within the medical profession, I think there's a lot of stigma about doing psychiatry, right? But I think now people really understand the value of it, and so people recognize how they, in becoming a psychiatrist, can contribute to the wider society. And so because of that, I think a lot more people are now interested and have been pursuing the specialty.
And what would you say keeps you going even after all of these years?
Well, there's a couple of things. I love teaching, and I like to talk, so maybe that's something I can talk all day long. But I really love teaching, and I love to see when students, whether it's the undergrad medical student or the postgrad doctor in training, when they get a concept and you see the light bulb go off in their mind. So I love that entire process, and so that keeps me going in terms of my role as a lecturer at UE. And beyond that, of course, I absolutely love my patients. I love every day I learn something new from somebody with whom I'm speaking every single day, and that's not that's actually what happens. Every day I learn something new, and I find that fantastic. So I really enjoy my work.
I love that you've mentioned, this patient-practitioner relationship with most of your patients and the importance of learning from them at the end of the day. Regarding your work with the University of the West Indies as a lead lecturer, what are some of the common questions you would be asked from some of your students as well, where psychiatry is concerned?
Yeah. I think students, and I mean medical students, they come into psychiatry sometimes a little bit apprehensive, because of course their exposure up until that point would be, what they see on TV or social media, and it's not always painted in the best light. And so sometimes students come in a little bit apprehensive. The language, the words we use in psychiatry is different to a lot of other areas in medicine. And so sometimes in the beginning, they struggle a little bit with that. Like, what is a delusion? And what is a hallucination? What does that mean? You know, flight of ideas. What are these terms you're all using that we've never heard of before? And over the course of the 8 weeks, which is the length of a clerkship, you see the understanding and of the concepts, and you see how it changes over that period of time. And so students come from being apprehensive a little bit to really understanding what all the terms and the concepts are. And so watching that has also been quite, I enjoy watching that process and that change as it occurs.
An exciting space to be in, Dr. Emmanuel. At this time, we're going to pause for a short commercial break. But when we come back, I'm curious to know about healing, where psychosis and psychiatry is concerned, the importance of the vision that you may have for psychiatry where Barbados is concerned for the next 10 or 20 years, and, you know, if a person can truly be healed from a mental health condition. As Mental Health Awareness Day comes up on October 10th, we're having this very important conversation with Dr. Maisha Emmanuel. Don't you go anywhere.
My name is Melissa Savory Gittins, and I'm the president of the National Organization of Women. Some people wonder, what is the National Organization of Women? And the National Organization of Women is a united group where we empower women, we work with women, and we have a number of affiliates that are registered as members under the National Organization of Women. Maybe you don't belong to a group, but you are a woman and you're willing to help. We're asking you to come on board with us, join one of our affiliates. There are plenty out there, and we need your help. The only way we can get this done is with you. You can find us on social media at NowBarbados246. That's our Instagram handle. On our Facebook, we are National Organization of Women Barbados. So join with us, work with us, and help us to continue to change lives for the better.
Hi, I'm Naomi. This National Cleanup Campaign is your chance to make a difference. Let's work together to protect our environment and keep our neighborhoods clean. National Cleanup Campaign. A cleaner tomorrow starts today.
Keep it clean, keep it green. Be proud of our nation's beauty.
Welcome back to this very special one-on-one. Dr. Emmanuel, we promised our viewers the importance of speaking of healing where psychiatry is concerned. And in your purview, is it really possible to be healed of a mental health condition?
Right, so that's one of the myths that we started to talk about earlier. So when it comes to psychosis, and with that we're talking about people who have experiences where they may be suspicious of others, they may be hearing people talking when there's no person around, they may have other beliefs that are not either partially or entirely true. And so for that condition, we do have to use medications, because remember I said medications are not always necessary, but definitely when we're talking about psychosis, medications would be necessary together with the talk therapy. And again, people can recover. Now, whether or not you need medication all of the time or some of the time depends on the particular condition you have, because psychosis in itself is not a diagnosis. Okay, sometimes people have brief conditions, sometimes people have psychosis in response to medication or even drug use, or sometimes people get psychosis because their blood sugars are out of control. So the psychosis in itself, or the terms, that doesn't tell you what the condition is, and it doesn't tell you whether you're going to need medication long term or otherwise. You and your doctor will have that discussion about what is the diagnosis and what the treatment plan would be and what the long term outcome is likely to be. But again, people should not think because somebody is having these particular symptoms, that means that the person has schizophrenia, which is the condition that people most associate coming to a mental health professional with. Schizophrenia makes up 1% of the population.
And 1%. This is worldwide.
Yes. And that's interesting that you asked that, because no matter where that the study is carried out in terms of determining how much of the population would have a diagnosis of schizophrenia, it's 1%. So you're equating a whole profession talking about 1% of people, right? And it's a visible 1%. So I suppose that's why there's so much stigma attached to it. But if you think of it in the way I'm saying, it's only 1% of persons in a population would have a diagnosis of schizophrenia. And so we need to leave room for what are the facts. We need to leave room for people feeling free to access care. We need to leave room for people having the support that they need to recover. Because remember, I was saying support is one of the biggest factors in how well somebody does. Okay? And so instead of focusing on the 1%, we need to focus on all those other factors and do our part in the recovery process for everybody who may need support.
You said something interesting. You said schizophrenia is part of the visible 1%.
Right. So what I'm saying is somebody who has schizophrenia, who may be behaving in a disorganized way, for example, people notice that. Okay, so it's easy to see that. But if I'm depressed and I'm withdrawn and I haven't been to work for 2 months and I'm in my bed, nobody's seen that. Who may notice that would be, well, my family, who would say, but she's in her room all the time. Or the workplace may say, well, you've not been to work for 2 months.
Right.
So the majority of people are not seeing you depressed and at home. But the majority of people would see you if you're doing something that seemed odd or unusual and you're out in public. So that's what I mean. It's the visible 1% versus the vast majority of other people with other conditions that are not seen. And hence why there's such a stigma attached to having that.
Considering the conditions of schizophrenia, for example, or bipolar to some degree, how concerned are you of persons who are high functioning but still are experiencing mental health conditions left untreated?
Yeah. So we do have a subgroup of people who would have active symptoms, but they are able to go to work. What persons would say to you is, I can do the work, but I am distracted by whatever other symptoms they're experiencing. So they may be high functioning in that way, but it does not mean that they're functioning at their best or their maximum potential.
Right.
So someone like that should still access care. Because you're great and you can give 80%, we would like for you to give 100%.
Yes.
Right? So it's not enough to be high functioning. I think it's important that you function at your maximum, wherever that is. And so people should still seek care and support, even if they're still capable of doing the jobs that they're employed to do.
There should really be no fear if a person is experiencing psychosis and making a check-in to the Black Rock Psychiatric Hospital, for example. There are numerous...
Right. So even, yes, you could go to the psychiatric hospital, but before you even go there, you could talk to your general practitioner. You can talk to your doctors, the general practitioners in the polyclinic. Because remember, the whole idea is we want people not to necessarily go to the psychiatric hospital for every mental health intervention that they may have. So talk to the people who are closest to you, okay? You may have psychologist program in your workplace, or as I said, the polyclinic. Go to those persons and access care there and not necessarily have to go to the psychiatric hospital.
And while you make mention of that, what's your vision for a Barbados where persons feel safe enough to speak out.
Yeah. I would love to see a Barbados in which the same way we may sit at our lunch table at work and say, my chest hurting me, I have to go and see my doctor. That we could sit and say, I have not been sleeping well, I'm really worrying, I need to go and see my doctor. So, meaning we feel free and able to talk about our challenges we may have, with mental health challenges we may have, in the same way as we will talk about any other physical health. In fact, to go a step further, we don't make a distinction between mental health versus physical health. It is health from head to toe.
Yes.
And so I would love to see a Barbados in which we have access to care regardless of what the ailment is or whatever the condition is. And we access care, we are confident that the care is equitable regardless of what it is, and there's no stigma attached to accessing that care.
Will you speak to these, what you're calling the dimensions of health, physical health, mental health? Can you expand on the importance of having all of these dimensions in balance on what they are?
It may seem obvious, but we have one body, meaning the brain, the neck, the upper, but everything connected. Okay, so it's quite artificial to separate the two things, right? And so health should be the focus. And the same way we would say you have to eat right and exercise, that is for health, be it up here or the rest of it. So it's the same parameters we want to talk about, okay? So when I talk to people, I talk about, balancing your meals. I try not to say diet because when people talk about diet, then they start cutting out this and that, and it's not sustainable. So I try not to talk about it in that way. But having balanced meals, exercising, going to church if that's something that's important to you, doing social activities, connections with other people, having outings, taking vacations, all of those things make us up as a whole. So we can't just look at one thing. Or I should say we shouldn't just. It shouldn't just be work and go home and that's it.
Yeah.
We have to fill the cup.
Yes.
On all the cups to make us whole. And so I think that's where the focus should be, and not separate what's mental health and physical health.
Following your suggestions of having balanced cups, physical health, mental health, social health as well, what percentage or how important is it as well, based on the cases that you've seen, for financial health as well, considering the state of Barbados?
Well, absolutely, because there's the top stresses people come with outside of relationship problems, whether it's your partner or it's your sibling or somebody at work. Outside of that, the next thing is financial stress. And so very important there to be able to address that. And obviously for some people that may be easier than others. We do have a social safety network in Barbados, but sometimes people say it's not enough. And so people struggle a lot. And obviously, if part of your clinical depression or anxiety is about financial stress, talking about it is one thing. Even if you need medication because it's severe is another thing. That is not going to address the practical underlying issue.
Right.
And so, people reaching out for assistance, that's been something that has been increasing in my practice over the years when I see people at the QEH, where people identify financial stresses as pretty much a significant problem in their lives.
But you said the number one cause for concern in terms of
relationships. And I made the point, it's not, when I say relationships, I mean human relationships, not necessarily intimate partners or whatever. Because, the way we treat one another can really create a lot of difficulty for each other. And so more than anything else, people talk about whatever difficulties they may be having with another person. and it could be at home or at work, wherever, but a lot of the times it's about interpersonal interactions that are hard to manage.
How do you cure those complexities then for a person who may be experiencing issues with a mother, a sister, a partner?
Yeah. So obviously it depends on the relationship the person has. So if it's somebody at work and you and you're all not, friends or something, you can't necessarily change the other person. So oftentimes it has to do with how do you as the individual cope with whatever it is the person is doing, as opposed to trying to get the other person to change, right? Obviously, if it's a partnership or if you live in the same household, you may approach that in a little bit a different way, where the person may be involved in the talk therapy sessions with you as well. So for each situation, it's by case how you manage it. But a lot of times people have to understand their ability to cope, what are the coping skills and techniques that they have learned or developed, and apply those to difficult situations. Because a lot of times you cannot force anybody to do anything.
Right.
Even if it's your partner or it's your mom or your sibling, you can't force them. So you have to work out what you need to do to be able to manage the situation with the other person.
And oftentimes, would you agree that it's not what happens to us, but how we react to what happens to us?
That is very true. As you go through life, there are always going to be ups and downs. And how you respond is based on what you have learned over the years, meaning what coping skills you have developed over the years. That is what is going to make the difference. So you and I can get into an accident, and I struggle because of just replaying the incident and so on, and you don't, because you have developed ways in which you cope. And so that with other parameters will determine whether you recover or if you don't recover, and how well you recover or not.
We oftentimes speak to Barbados being the gem of the Caribbean. How can we continue to build on what we have, the successes of the island as a small island developing state, in terms of building out emotionally resilient and emotionally intelligent Barbadians for generations to come?
Yeah. I think we have to look after ourselves as individuals. I think going back to what we were talking about, how to remain healthy, I think we need to practice that a bit more. And when we are able to look after ourselves and be healthy, then we can have healthy relationships with other people. And so I think that will go a long way towards what you're talking about in terms of maintaining and building out a resilient community.
And I'm also curious to answer, there's been a lot of conversation about niche tourism. And I'm curious to know, do you think there's an opportunity for wellness tourism? Barbados is surrounded by beautiful beaches. When people come here, they feel at home because of how they're treated by Barbadians. So do you think there's an opportunity for wellness tourism where the island is concerned as well, from where you said?
Yeah, of course, I think there is. I think, though, we have to be careful how we manage that, recognizing that it's not just sun and sand and sea and nice people when it comes to mental health and mental health awareness. And so, for the conditions where, or in the situations in which that is enough, then that's wonderful, that's great, we encourage that. But for situations where you need a bit more, we also have to be able to provide more if we're going to have people come here for mental health conditions.
And second to that, what's your message for any young Barbadian watching the program at this time as we acknowledge World Mental Health Awareness Day on October 10th?
Right, so going back to the theme about accessing services, I think that is so important. There are many ways in which young people can access mental health care. We've talked about quite a number of them just now. One last thing we did not talk about was the lifeline that the Ministry of Health has developed. And so people can contact the lifeline as well as another point of access. But access is the take-home point based on the theme of the Mental Health Day.
Well, thank you so very much for your time, Dr. Emmanuel. Wishing you all of the best in your work with the Ministry of Health and your work with the medical doctors as well that you're teaching at the University of the West Indies.
Thank you for having me.
You're most welcome. We've come to the end of this very special program with one of the leading psychiatrists here in Barbados, Dr. Maisha Emmanuel. On behalf of my producer, Anay, I'm Michron Robinson. Until next time.